Hi, my name is Ariel and I'm an exercise oncology educator with Maple Tree Cancer Alliance, and today I will be talking about the basics of exercise, and at the end we will go through a few minutes of gentle movement. Let's get started. What is physical activity? Physical activity is any bodily movement produced by the skeletal muscles that require energy expenditure. This could be small muscle groups, it could be large muscle groups. Some examples of physical activity are taking a walk, taking the stairs instead of the elevator, maybe parking further away at your appointment or at the grocery store, getting up and down out of a chair, and cleaning. Think of taking the trash out, making your bed, vacuuming, putting the dishes away, emptying the dishwasher. Again, physical activity is any bodily movement produced by the skeletal muscles that require energy expenditure. What is exercise? Exercise is defined as a type of physical activity that is planned, structured, and repetitive, and has the goal of maintaining or improving physical fitness. Examples of exercise are strength training, aerobic training, flexibility, and balance. So what is strength training? It improves the strength and endurance of the musculoskeletal system and is also known as resistance training. This type of exercise also counteracts, the muscles counteract against an outside resistance. Some examples of strength training are yoga, which is a mind, body, and breath practice. Pilates, which is a low impact type of exercise to strengthen and build muscle. You have machines, so if you have a gym or a facility that has equipment, you can always try out their machines. We have TheraBands. There are TheraBands like this. You might see a looped band that looks more like this, that is tied at the one end, or you have bands with handles on the ends, which might be easier for some people to utilize during treatment if they have neuropathy or things like that. And then we also have a kettlebell, which is a bell on the bottom with a handle on the top, which can be done, doing some upright rows. We can do some kettlebell swings. Okay, these can come in handy in multiple different exercises. And then we also have a hand weight. You can do bicep curls, you can do a shoulder press, and then you can also do a bent over row, tricep kickback. Bent over row, tricep kickback. If you do not have any equipment, that's okay. You can always rely on your own body weight. For example, some exercises that you can do are some body weight squats, coming down, squatting. You can also do some lateral leg kicks, strengthens the leg and the core. You can also do some punches overhead. Again, if you don't have any equipment, you can always do body weight exercises. And again, strength training is a way to improve the strength and endurance of the musculoskeletal system, and is also known as resistance training. What is aerobic exercise? This is a type of physical activity that uses large muscle groups. It's rhythmic, repetitive, and increases your breathing and your heart rate. Some examples of aerobic activity are climbing the stairs, step aerobics, walking, swimming, running, cycling, anything that's going to increase your heart rate and increase your breathing. And the best part about aerobic activity is that you have the ability to adjust the intensity. The intensity is how hard your body is working during that single bout of exercise. So if you feel like you're working too hard, you can always slow it down. So if you're on a jog and you're like, I can't go anymore, bring it down to a walk and let your heart rate settle. And then when your body allows you to, start jogging again. What is flexibility? Flexibility is the ability to move a joint through its full range of motion without pain. Some things that cause a decrease in flexibility can be a surgery. Surgery can significantly reduce the range of motion through the affected area. And inactivity in older age. Most of the time as we age, we tend to move less and sit more. This can cause a loss of water in our tissues and spine, and also increases the stiffness in our joints, along with a loss of elasticity in and throughout the muscles, tendons, and surrounding tissues. And lastly, we will talk about what is balance. Balance is the ability to stay upright and steady and maintain your center of gravity within your base of support, whether you're sitting, standing, or walking. The sense of balance relies on several signals from different parts of the body, and these signals are processed through the brainstem and other parts of the brain. Some examples of these signals that are then sent to the brainstem and to the other parts of the brain are your ears, eyes, muscles, and touch sensors in your legs. Again, balance is the ability to stay upright and steady and maintain your center of gravity within your base of support while you are standing, walking, or seated. And now let's talk about rest time. Rest time is super important, and it ensures safety, effectiveness, and comfort. We want to make sure that we are allowing at least 24 hours in between strength training sessions and high intensity exercise, because it prevents fatigue. You are able to adjust the intensity. You avoid overexertion, and you also allow for heart rate regulation. So it's just as important to rest in between sessions, but it's also important to rest within a single bout of exercise. So in between, say you're doing bicep curls and then squats, you do 2 sets, 30 seconds, you would want to rest in between your first set of bicep curls and squats before you get into that second round. This way you can allow your heart rate to come down, and it also avoids overexertion and prevents fatigue. Again, rest time is important because it ensures safety, effectiveness, and comfort. Lastly, I will talk about the components of a workout. When we think of a workout, we always want to start with a gradual warm-up, which is used to prepare the body for what exercises are to come in your actual workout. This also gradually increases your heart rate, circulation, and most importantly, reduces the risk of injury. Component number 2, strength training. We talked about this earlier, but it enhances your muscular strength, helps counteract muscle loss from treatment, and improves overall functional capacity. Component number 3, cardio, also known as aerobic exercise. This improves your heart health, boosts your energy levels, and helps manage weight and fatigue. And lastly, we always want to cool down after a bout of exercise because it gradually lowers your heart rate, promotes relaxation, and aids in muscle recovery. Again, those components of a workout are a warm-up, strength training, cardio or aerobic, and then a cool down.
I'm Vanessa, your exercise oncology instructor with Maple Tree Cancer Alliance. Welcome to our 8-week seated core exercise program. In this program, our goal is to incorporate core strengthening activities that will provide essential increases in quality of life. This week, you will only need a chair. Safety is our top priority in this program. Please exercise caution with all movements. The following exercises are meant to be pain-free. If you experience any pain from these movements, please skip the movement or stay in a pain-free range of motion. Let's get started. Let's begin with a quick warm-up. We're going to start with diaphragmatic breathing. So let's put one hand on our chest and one hand on our belly. We're going to do a deep inhale through our nose. Exhale out your mouth. Let's do a few of those. Two more. Last one. All right, let's do some seated cat-cows. We're gonna put our hands on our knees. For cat, we are going to round our back. And then for cow, we'll push our chest forward. Let's do a couple of those. Good, do them on your own pace. Let's do one more. Good. All right, let's do some shoulder blade squeezes. So we're just going to push our shoulder blades together behind us and release. Squeeze back. Release. Let's do two more. Good, last one. Good, let's do arms out in front of us. We're going to stretch out our shoulders in front of our face, bring them out to the side, like a goalpost. Good, one more. All right, let's stretch out our wrists. We're gonna extend our right hand in front of us. Fingers are pointing towards the ceiling. Use your other hand to pull your fingers back towards your body. Hold here. And then switch, pointing your fingers down, pulling your fingers back towards your body. Good, switch to the other side, fingers up. And then fingers pointing down. Good, let's roll our wrists a little bit. All right, now that we're all warmed up, let's move into the core portion of this workout. So we're gonna be in our seat the whole time, and we're going to have 5 movements. We're gonna do 2 sets of each movement between 10 and 20 reps. So we are going to start with a single leg knee crunch. So let's move to the edge of your chair a little bit. You're gonna do hands right next to your head. We're gonna start with our right leg, bringing it up, crunching in towards our body, keeping a tight core the whole time. Think about bringing your belly button to your spine, shoulders are back. We've got good posture the whole time. So we're gonna do 10 on each leg, take a break, and then we'll do one more set after that. When you're ready, let's get started with the right side. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Let's switch to the left. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Great job. Take a breather. Make sure you have some water with you. All right. Let's do hands behind our head again. Make sure we're sitting up nice and tall. Engage that core. Let's start with the right side. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Switch to the left. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Great job. Go ahead and take a breather, and I'll explain the next exercise we're going to do. It's going to be knee to opposite elbow. So we're going to have hands behind our back again. We're going to lean back into our chair just a little bit. If you have a chair with a back on it, you can rest your upper back here, or you can hold yourself up using your core if you feel like you're ready for that. We're gonna do hands out to the side, elbows out to the side. We're going to bring our elbow to touch our opposite knee, coming back up, switching, coming back up. So we're gonna do 10 reps on each leg, but we're gonna be alternating sides, so it'll be 20 total. When you're ready, let's do hands behind our head, lean back, engage your core, belly button to spine. Let's get started. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, halfway, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Great job. Shake out your arms a little bit if you need to. Your shoulders might be a little sore from holding them up for so long. You can sit back in your chair, take a quick breather before we do our second set of that. All right. When you're ready, go ahead and get into position. Scoot to the edge of your chair, hands behind your head, leaning back just a little bit, engaging your core. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Great job. We're done with 2 core workouts so far. We've got 3 more left. While you're taking a breather, I'll explain our next exercise. We're going to do seated marches. So you're gonna wanna sit on the edge of your chair, nice and tall, shoulders are back, thinking about really engaging that core here. You can do hands on your hips even. If you'd like, really thinking about keeping that core tight. We're just going to bring one knee up at a time, focusing on using our core to bring our knees up. So we're gonna do 20 total, 10 on each leg, alternating legs. When you're ready, go ahead and get in position. Shoulders are back, sitting up tall, engaging that core. Let's get started. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Great job. Take a breather. We'll do one more set of those. When you're ready, hands on your hips, sitting up nice and tall. Squeeze that core, belly button to spine. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, halfway, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Great job. Take a breather. I will explain our next exercise here. It's going to be a single leg heel tap. So we're going to do 15 reps on one leg, 15 reps on the other leg, and then we'll take a break. So you're gonna sit up tall here, edge of your seat, shoulders are back. Again, you can put your hands on your hips to really focus on your core. We're going to have our feet planted on the ground, knees are bent. We're going to extend left or right leg out, tapping our heel on the ground, bringing it back up. Thinking about keeping your core tight the whole time. We'll do 15 on our right leg, 15 on our left leg. When you're ready, let's get set in position. Core is tight, shoulders are back, sitting up straight, and out for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. Good. Switch to the left. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. Great job. Take a breather. It's a long time to keep your core engaged. All right, one more set of those. We're going nice and slow with the reps. We don't want to rush through just to get done. Let's focus on keeping that core engaged. All right, when you're ready, sit up nice and tall. 15 reps on one leg, switch into the other. Last set of these. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. Switch to the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. Great job. We've got one more exercise left. I will go ahead and explain it to you while you're taking a break. So this is going to be a chop, like a wood chop. And normally you would hold a dumbbell, but we're going to start unweighted for this. So if you want to put your hands together like you're holding a dumbbell, we're going to start up on the right side, chopping down to the left, focusing on keeping your core tight here, like you've got an axe and you're chopping wood. So we're going to do 10 reps on one side, switch, do 10 reps on the other side. When you're ready, you can sit on the edge of your chair, sitting up nice and tall, engaging your core. Hands are together, up to the right side, and down for 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good. Let's switch. Hands up to the left. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Great job. Take a breather. We've got one more set of those. Then we'll do a cool down and we'll be all done for week 1. Take a drink of water. Get ready for our last set. Feet are on the ground, sitting up nice and tall. Engage your core. Hands up to the right side and down for 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good. Switching to the left. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Great job. All right, let's move into our cool down. We're going to start with a hamstring stretch. So we're going to be on the edge of our chair. Extend your right leg out in front of you, toes pointed to the ceiling. Let's reach down. Try to touch your toe if you can. If not, you can rest up on your quad, down on your shin. Whatever feels good for you, getting a good stretch in your legs. All right, let's switch. Left leg comes out, toes pointed to the ceiling, and reach down. Good. All right, when you're ready, let's go ahead and sit up. We're gonna do a chest opener. So we're gonna do hands behind our head, pushing our elbows back, feeling a good stretch in our chest. Holding here for just a few. Take some deep breaths. All right, let's go ahead and take our right arm, bend it so your elbow's pointing up towards the ceiling. We're gonna take our left hand, push down on your elbow, stretching out your tricep. Good, holding here for just a few. Go ahead and switch to the other side. Awesome. Let's go ahead and do a side stretch. Let's do left hand on left hip. Right arm is going to come over to the left side. And switch. Awesome. All right. Great job today. Thank you so much for joining me for week 1 of this seated core program, and I will see you next week.